Okay, let's get report over with. Room number 1 is a 35-year-old female who was in a motor vehicle accident, partially ejected. She came in contact with high-tension power lines, and she has significant burns on her left leg and scalp. The scalp burn is 2 inches circular. All the CTs were negative, and she went to surgery for debridement at 9:30 this morning. They estimated 20% of her body surface area to be burned. She's 84 kilograms, and the fluid replacement, per the doctor's orders, was calculated to be 6,720 milliliters in the first 24 hours. She received 3,360 milliliters over the first 8 hours, and now the lactated Ringer's is running at 210 milliliters per hour, and it'll finish at 2 a.m. She still has her Foley in place. Vital signs are Q4 hours, and right now that her pulse is 105, respiration's 18, blood pressure 110/68, O2 sat 98% on room air, and that is it on her. Room number 2 is Janice Andrea Smith. She's a 21-year-old female who was in a motor vehicle accident. She was an unrestrained driver that hit a tree. She was admitted yesterday at 10 a.m. for back pain and acute alcohol intoxication. Her initial ETOH was 385. All her CTs were negative. The plan was to hold her until she was sober and repeat the head CT this morning, but she was experiencing some nausea, vomiting. Her heart rate was elevated. Her blood pressure was elevated. So I did a C-wall scale on her, and it was 42. I also talked with her, and she says she does drink every day. She has like 4 drinks every single day. And the doc ordered some fluids for her, some normal saline, 200 milliliters per hour, and ordered Ativan 2 milligrams IV push. She's on seizure precautions. I called to try and get her a bed in the ICU, but she's still here for now. Room 3 is a 47-year-old male who was in an industrial accident 4 days ago where he was run over by a large 10-ton forklift. He had crush injuries to both lower extremities below the knee. His left leg had to have a below-the-knee amputation yesterday. His right leg, ortho did reconstruction with an external fixator. During the shift, he was complaining that the pain was unbearable in his right leg. It was swollen for him to touch, cold. I called the surgeon because I suspected compartment syndrome, and he went for an emergency fasciotomy. He just came back recently. His vitals are stable. He was complaining. Well, he was talking about how he thinks he's depressed also. So we consulted psych, and they came up and they talked to him, and they started him on an SSRI. His Foley is still in place. It's been draining clear yellow urine, and that's it. Do you have any questions? Okay, great. Bye.